Welcome to our broadcast, The Path to Be Well, a knowledge and learning session. And today I have the pleasure of having my colleague Paul join us. And the goal today is to bring clarity about cannabis misuse, heavy use, dependency, perhaps addictions, and risk factors. So you won't want to miss it. Now, to all our listeners, we're so happy that you have joined us. Also, note that you can also subscribe on our YouTube channel or find us at weedwell.live. Now, these sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you. And will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do them and us a favor by sharing this event. Hi, my name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit that I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open, and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I personally witnessed countless individuals and families experience improved quality of life. Now, having said that, I also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one size fits all. And determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So again, Paul Calori is joining me today. Paul, how are you doing?
I'm well, Mark. Thank you. And quite a topic to discuss today. I thought it was interesting to bring this into play. We've spent, since the latter part of January talking about things to propel you forward, whether it's SMART goals or health journaling or how CBD or THC can help you. A lot of the good things to cannabis as a medicine, and relating stories and information of people who have benefited from it. This topic today isn't meant to be negative in any sort of way, but it is just to keep your eyes open that not everything is good about it. And we want to bring in cannabis misuse, as you've already opened up. And so, the topics during the week were more geared towards THC and the different things that you might find negative towards that, or that can affect you negatively, because we're all about health and improving wellness. And if we're at least not cognizant of that, we're probably not doing our job from Weedwell's end. And so cannabis misuse or cannabis use disorder, and over time it's evolved in different manuals that would diagnose it. But it is very small percentage of people are affected this right now, like low single digits, very small percentage. But when you look at the number of cannabis users or regular cannabis users, that number can be pretty big. So what we want to do is start by looking at the term dependence, let's say, okay? And dependence is something, as the name implies, you become dependent on someone. And so in terms of cannabis misuse, your body becomes dependent on the cannabis. And in that, we see two things: tolerance and withdrawal. So, with regards to THC, is usually where we see this. The same dose isn't doing the exact same as it used to do. Or if you withdrew it right away and stopped, you might notice that the cannabis isn't there doing what it was doing before. So dependence in and of itself isn't a bad thing, and dependence doesn't mean addiction. It just means your body's become accustomed to what the cannabis is doing, whether it's pain relief, whether your anxiety's in check, or stuff like that. Addiction kind of takes it a step further, though, insofar as the idea of gaining cannabis or getting cannabis or using cannabis kind of overtakes everything in your life, and there might be health considerations or safety concerns or stuff like that. And so it kind of takes it to a whole nother level. Now, what you'll find is dependency, as I said, in and of itself is not a huge issue. Dependency may or may not be part of addiction as well, although often it is. So what I wanted to do, as opposed to figuring out if you're here or there, and you don't even have to be in one place, like not everything needs to be labeled. I went right to the DSM-5. I have an article from Hassan, O'Brien, and Oricombe, just so you know. It comes right from American Journal of Psychiatry. And here's things that they look for right in the DSM. So the DSM is Diagnostic and Statistic Manual Edition number 5. And these are the people that define disorders. So whether this is where you'll find PTSD and what you need to have that, or anxiety disorder and what you need to have that. Well, this is the same for the substance use disorder. So taking more cannabis than was intended. Okay, so if that's you, that's you. Difficulty controlling or cutting down cannabis use, spending a lot of time on cannabis use, craving cannabis, problems at work, school, and home as a result of cannabis use, continuing to use cannabis despite social or relationship problems, giving up or reducing other activities in favor of cannabis, taking cannabis in high-risk situations, continuing to use cannabis despite physical or psychological problems, tolerance to cannabis, and withdrawal when you discontinue cannabis. And so those last two are where the dependence comes in. But when you have a criteria of 12 things, those are but two things when we talk about cannabis use disorder. And that's why one doesn't necessarily mean the next. Does that make sense to you, Mark?
Absolutely, yeah. Carry on, because it's unfolding nicely.
Okay. And so, that's our definitions type thing that we need to talk about. In the end, what we promote is a few things. And in our Be Clear area, certainly from our course perspective, the Path to Be Well course, one of the things we do talk about is cannabis use disorder. And there's pros and cons to different questionnaires, in that you can get questionnaires that ask a lot of the types of questions in the list of symptoms that I just got. Are you spending 2, 4, 6, 8 hours as a multiple choice, if you will, a day being stoned? Are you missing work to use cannabis? Are you missing appointments? Are you using it when you should be taking care of the kids, et cetera, et cetera? And so those are very applicable to what I just said as a cannabis use disorder. One negative to those questionnaires, though, you often find frequency of use. And quite often we have patients, clients, and consumers that will use a CBD product daily. And that will keep their anxiety in check, as an example, or their pain in check. And we don't necessarily, certainly in a clinic at Weedwell, we don't necessarily see that as a negative insofar as a treatment plan goes. It might very well be an important part of a treatment plan. And so frequency of use in and of itself, it's not a determining factor at all. It becomes more the how and why and where you might use it. Good so far?
Actually, yes, Paul. But for any listeners that may have missed kind of the opening statements that you made, I think it's a good time to repeat them. That this is not to be looked at in a negative way. That this is information, and clients that come to see us rely on our ability and call it expertise, if you like, in that field, in that domain, to be able to bring clarity to them and help and guide them through that. And this is all part of that. So, yeah, it's still very good, Paul. Just carry on. But I just thought it might be worthy of mentioning that for anyone who's joined us late.
Oh, for sure. So let's talk risk factors. And as opposed to getting into a huge list, because it might apply to you, it might not, we'll go to the big ones that we've seen over time. And if you go to find literature on cannabis misuse or cannabis use disorder, what you'll see is, generally speaking, people under 25 consuming cannabis and specific to THC, cannabis on a regular basis under the age of 25. And that comes to brain development. As your brain is not fully developed until the age of 25, there are potential repercussions that way with some more mental health symptoms. You'll see schizophrenia in literature and stuff like that. But the younger you start, there's a higher potential for misuse. The other one is with regards to higher THC content cannabis. And I think this is very appropriate in today's day and age. Over the years at the clinic, I've seen, you know, just dry cannabis, and you kind of maxed out at 20% THC, maybe low 20s, and over time the dry cannabis is now pushing up into the mid 20s. And if you look historically, cannabis in the 70s or 80s, you might see single digits as being potent cannabis. And so we definitely see a trend over time of just by production, an increase of THC content, and that's dry cannabis. Now we have all sorts of other methods when we extract the THC from the plant or the CBD, but we're more focused on the THC in this discussion. And right now, you see some vape pens or vape cartridges in the areas of 60, 70, 80% THC. Now, that's not to say they're bad. I can't blanket statement that many people will use those products in a microdosing type thing. It gives instant feedback because you're inhaling it, and you can stop after one quick puff or whatever the case may be in your treatment plan. So just because I bring up that product doesn't mean they're all bad. What we do know though is higher THC use and higher frequency of high THC use tends to lend itself to increased anxiety, increased paranoia, increase in psychosis. And so that's your hallucinations and where you lose total touch of reality. If I use a vape pen, does that mean that will happen to me? No, absolutely not. But it's just something to be aware of the kind of few things that we absolutely have an idea or a simple search of articles of will show you that that's the case. Okay, so those are a couple of the things that you want to look for. In the end, what we ask of people in this discussion, and it's not meant to beat yourself up or put a point at you or anything like that. Ask yourself your reasons for use and answer honestly. It's all about your health and your wellness at this point. If you don't answer yourself honestly, you're just doing yourself a disservice. But, if at the start of your treatment plan, let's say it was 100% to help my chronic back pain and 0% for the euphoric feeling, and over time you find that maybe is 70-30 or 50-50, swinging from one lens to another, then maybe it's something you should ask yourself on how I'm using it, or why I'm using it, and the role it should play in your treatment plan. Only you can answer that. Again, it's not meant to finger point, but it should put a thought into your head. Am I using it the way I had intended to use it as part of my treatment plan, as part of my wellness plan, as part of my path to be well? And so answer those questions honestly, and it kind of tells you where you need to go.
So, Paul, yes, and to elaborate on that, it's quite conceivable that a client consuming THC initially was with all the right intentions, and then over time and progressively, as you know, maybe that has changed now. So it's a time to, as you said, just to reflect on this and ask yourself and answer yourself, why am I really doing this? And maybe that has changed from the time of introduction to the point that they are today. Maybe the intent has changed over time for a number of reasons.
Again, this will apply to a very, very small amount of people. But now the next step is, if you answer yourself honestly and you find I'm not using it the same way as I set out, that's okay. That's a good identification tool. And so, there's tons of sources of help in this specific field. And so if you're in Canada, there's an article, Get Help with Problematic Use. It's a canada.ca. It's right from the Government of Canada website. And that actually lists, in by province, sources of help depending on where you're at. In the U.S., just quick Google problem use cannabis or what have you is going to bring up a ton of resources. I myself was earlier on drugabuse.gov, and one of the first things was, if you have problems with cannabis use, click here. So it's not hard to find. It's out there. But it's all part of your health and wellness. So if you do feel that you have a problem, your first step can be your primary care provider. If you don't want to go to them, I've given you, at least from a Canada, US point of view, some sources. But the reading is huge on the internet to this subject. At least start reading about it. Try to get a handle on, if some of the things you're reading match you, and then that will allow you to make decisions based on what it is that you find out about yourself.
Yeah, for sure, Paul. Paul, if I can just go back, and it's not a major point, but if some of our listeners are indeed under the age of 25, I just want to highlight the fact that it's with good reason, scientific, medical reason, why we say use caution when you're consuming THC under the age of 25. By no means is this a way of discrimination by age. It's really for scientific medical reasons, Paul.
Yeah, it totally has to do with the brain development, and it's just not complete to that age. And so, if it's something you want to try and you can push back, good for you. Certainly, from we'll say a recreational or pleasure stance. Medical stance, like everything in life, you're going to weigh the pros and cons. We've talked about this, and if it's part of your treatment plan, and you've discussed this with your provider or providers, as the case may be, and this is a risk that you're willing to take, then that's part of your treatment plan. But it does come to the brain development, and it tends to end at age 25. So that's where that number comes from. It's not pulled out. So, you've mentioned already, it's not meant to point fingers, make people feel bad, but I think it is a topic that does not get discussed enough. It does exist, and we've spent a lot of time, and will continue to spend a lot of time on a lot of the positive impacts that cannabis has had in many, many clients, consumers' lives. And it's just meant to be aware that this does exist. And if there's issues that you notice internally, It's not because you're odd or different or anything like that. It's just, it might be what is happening to you. Recognition is a start, and that's why we're having this discussion here. So you recognize, and then it allows you to do something about it, whether it's discuss with your primary care practitioner or seek out some of the sources that I mentioned. And the governments, at least in Canada and the US, have loads of sources that way if you should find yourself needing help.
Yeah, Paul, I just wonder if this is a good time to, if you can, just reiterate some of the resources that you've referred to today already, and DSM-5, what it is, and how that would be. Uh,
So the DSM-5 Diagnostic and Statistic Manual, 5th edition, it gives the criteria for diagnosis of everything under the sun: mental health disorders like anxiety or schizophrenia or PTSD. And in this case, the list that I had read off earlier is specific to DSM-5 criteria for substance use disorders, recommendations, and rationale is the actual article that it came from. And so that's where we're in disorder, we have a problem. Previous, I just talked about dependence and how it is a part of, but not necessarily a defining part of the problem. So that was the initial part of the discussion. The Government Canada website that I was talking about, the article is "Get Help with Problematic Use," and what you can find from that pretty quickly, certainly at the bottom of the page, you can start clicking and it'll bring you to different resources of help. But the page itself has different provincial resources. I believe had NADAP in there from an Indigenous standpoint. But there's loads of sources from we'll say adults to younger people as well. And that was from a Canada website. Where I was with the States was drugabuse.gov, but many resources in the States, certainly from a government standpoint, that I'm less familiar with. I don't live there. It's very simple if there are issues to piggyback off something like drugabuse.gov to figure out where help or sources of help are.
yeah, so thanks for doing that, Paul. And by far, very credible resources. And obviously, this what we've talked about today are not opinions of one or two guys. These are from very credible sources.
In the end, evaluate yourself on why you're using it, and be honest with yourself. It is a problem that affects a very small percentage of people, but it is a potential problem nonetheless, and it will impede your path to health and wellness. That's why we bring it up. And one thing to keep in mind, just with regards to this whole thing, we often talk start low, go slow. And in my discussion on risk factors, again, they're risk factors, they're not guarantees, but risk factors was high frequency, high percentage of THC dosing. And so, if you find a product that works for you that is of a lower percent, or you can use less often, it might be more beneficial than upping that percentage or upping that frequency. And I guess the easiest way to look at that is think of doing laundry. And if the thing says put 1 cup of detergent in and it will do the job and clean the clothes, don't put 2 cups in because it's not going to become extra clean. So that start low and go slow, that certainly speaks to the low part. So we're looking at dosing at a minimum to relieve your symptoms. Don't go without symptom relief. That's not what we're saying at all. But if you find that you find that sweet spot at a small amount, stay there. There's no need to take more, or no need to change something and take a higher percentage, let's say, when we're talking in terms of THC.
Yeah, that's right, Paul. And it boils down really to looking at your treatment plan, your medication list that you're on. And we've seen this, I'm sure you have as well, Paul. Too often, THC is used as a tool, but because of the lack of knowledge of other options, perhaps. And then the THC is effective in perhaps numbing the pain or taking your mind off the pain. But there could be very good, effective alternatives to that. So what I'm saying is THC is often not the answer to everything, although it is a good tool in the toolbox combined with other, medications, and CBD is one of those.
For sure. It's well, they're all tools in the toolbox, and they all can be part of further health treatments or health therapies or health plans. There's no doubt about that.
And Paul, because we are on the topic of the safe use of THC, one of my episodes this week was aimed at a novice or like a brand new user, and it was really be cautious. Um, the safe ways to do it with a small amount to go low, start low, go slow, but in a measurable amount. So if you can measure it, you can basically control the amount that you're taking. But the point I really wanted to drive is if it's not measurable, you're better off to, stay away from it because you could be having adverse reactions that are less than desirable. For example, if a friend is offering you a brownie, and this is something that's foreign to you, as a novice, perhaps first timer, that's probably not the place to start. Yeah, so that was part of one of the discussions this week that I thought would fit in with this as well. So I threw that in there. So Paul, any closing comments at this point? You've done an exceptional job, really, of gathering all of this information, bundling it in a way that was well presented, and I believe would have been of value to any of our live listeners or anyone that will listen to us in future broadcasts or podcasts, rather. So speaking of podcasts, the site for that, Paul, I'm putting you on the spot here.
Podcast.weedwell.com.
Very good. Yeah, we tend to do that between each of us, is to put each other on the spot, and it's a test, I guess, in some ways, or for some of us. So my understanding is that this live session by middle of next week will be added to our podcast as well, and to our audience. There's a fairly extensive list of podcasts now that could be of benefit and of value to anyone listening to them. And perhaps someone that could benefit from this as well. So please do that. So Paul, as we get close to wrap up time here.
A quick summary.
Yeah.
So we gave the list of things. I think we'll be able to share that at some point, perhaps on our Facebook, the Pastor Be Well page. And it's just ideas to keep in mind, how you're using cannabis as part of your treatment plan. But in the end, just ask yourself about your intentions, how it is part of your treatment plan. Be honest with yourself. And if you see an issue, don't hesitate to reach out, because it is definitely something that you want corrected, you want help with, and it will lend itself to further your health and wellness and your path to be well.
Very well said, Paul. So as I do and proceed with my wrap up and closure here, to all of our listeners, I'd like to remind you that the information sessions are intended for individuals who are in general good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including anything for medical and health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. Now, for those who have taken some steps in improving their quality of life, congratulations. And remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul and myself and our team behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.